I've noticed recently that a lot of nurses are having a difficult time landing interviews. And honestly, what I've seen is that it has a lot to do with your resumes. I was a recruiter for 9 years. I hired nurses for 6 of those years. And within that time, I rarely read a resume completely in its entirety. And I didn't have to because I had a resume reading robot that would actually read it for me. So I put together the top 5 tips that I've accumulated over the past 10 years to help you optimize your resume so that it'll make it through the robot and onto the desk of a recruiter. I've also teamed up with nurse.org, which is an awesome career website for nurses. It has a great job board on there as well. We've teamed up to create some resources for you to really help you create the ideal resume. Now, I'm sure that you are aware that you need to include keywords into your resume, but a lot of people are like confused about exactly what keywords to put in their resume. So I'm just going to tell you a little bit from an employer's perspective what we look for. So the resume reading robot, it's not an actual robot like no. It is software. It is called applicant tracking software, or ATS. And what it does, it's basically a program, and a hiring professional, recruiter, whoever it is, will go in and tell the program specific keywords that it wants the program to look for resumes for a specific role. So we could tell it to look for keywords that we have built into our job posting. We can also ask it to look for disqualifying statements. So an example of that might be if you have an ADN degree, but we need someone with a BSN, then it will automatically disqualify you if you don't have a BSN. We could also tell it to look for disqualifying questions. So it might actually prompt you to answer a question whenever you're online filling out an application. So for example, it could ask you, do you live over 10 miles from the facility? So that's a disqualifying question. We can also, as recruiters, go into the database and search resumes ourselves. So if I'm just randomly looking to fill a certain med-surg role, I could go in and under the specialties section, just type in med-surg with 5 years experience, and it'll bring up all of the med-surg nurses that are in my database who have 5 years experience. So that could be thousands of them. So that's kind of what it looks like from my end. So the keywords that you need to put on your resume are specific keywords that are in our job posting. So anything to do with our mission, vision, values, specific words that we use in our job posting, even if they're different words than what your facility uses, you need to use the keywords in our specific job posting. Now, I often see resumes that still have objective statements on them. And honestly, it's super outdated and it just takes a valuable space on your resume. So an objective statement is something that says, what is basically your objective. So maybe to obtain a registered nurse position on an ICU unit. That might be your objective. So it's kind of like if you're applying to an ICU position, you should already meet those minimum qualifications. So why do you need to even state that on your resume? So I encourage people to actually write professional summaries on their resumes. They can be in a bullet point format or 3 to 4 sentences, but it's basically a snapshot of who you are as a professional, and load it with those keywords from our job posting and tell them, specifically why you're qualified for the role. So employers care about what you can do for them. They don't care about what you want to do for them. They want to see evidence, what you've done and how you can do it for them with the least training possible. Job specifics. I've seen thousands of resumes who don't list enough specifics about their actual jobs, and I'm sitting there okay, what did this person actually do? What EMR did they work with? What kind of patients? What kind of equipment did they use? So don't use really vague general statements. Tell me, what is your hospital's designation? Do you work for a teaching hospital, a level 1 trauma center, a community hospital? What is it? What EMR do you use? How many hospital beds are in your hospital? Do you work in a huge hospital, or are you in a tiny community hospital? How many beds are on your unit? How many patients, what's your nurse to patient ratio? So employers want to see that you're going to be able to fit into their specific hospital and that you have experience in similar hospitals, or that you have trainable, transferable skills. So it's important to, really talk about the medications you've administered, maybe the cases that you've worked on. If you are, trained in a specific type of therapy, or really excellent at starting IVs, things like that. They need to know that. So make sure to list those details under each specific job. So I like to kind of live by the rule that, keep it simple. I've seen the most gorgeous resumes, like with beautiful graphics and like formatted all these pretty ways, like all these different colors, and it's so eye-catching to me, and I'm like, whoa, I really want to meet this person. But like those resumes get to me a different way. Like the person I might know them personally, or like they email it to me directly. I don't see those resumes come through my ATS, my resume reading robot, because the robot can't read them. Like honestly, they can't read them. They are they're not as smart as humans, first of all, but they're programmed to read specific data. So specific fonts, really, so simple fonts like Arial or Times New Roman, but they can't read like really fancy fonts. Some of them can read colors, some of them can't. If you have any typos, they'll get confused. If you, call a word something, that might mean the same to you, but like you don't call it the exact same word, then the ATS doesn't even know that you have the experience that you need, and it disqualifies you. So just really keep it simple formatting, black words, no fancy graphics. So if you're a young nurse, don't skip over this section, because age discrimination applies to you. It applies to everyone. It is the number one form of discrimination in an employment setting in this country, the United States, and it needs to be addressed. So what I encourage people to do is to leave your graduation date off of your resume. You do not have to include it on your resume. It is never a requirement. And I encourage this because I've been in places where I've hired nurses, and I've just hired people in general, and I've heard some very wrong things, some judgments made towards people based off of their age. So, an example is like for a millennial nurse, someone said, oh, she's going to get her paperwork into us so fast because she's a millennial, which, okay, cool. Like it's not really discrimination, but like they know your age now. So like they have this picture already drawn up in their head of who you might be. And I've heard also complaints from nurse managers. Like if I send them an older nurse, they might have said to me like, oh, she's not going to be able to keep up with the pace. She's a little older. Okay, she definitely could. Like, who are you to judge her? So just avoid all of that by leaving it off of your resume altogether. And I don't even think nurses should put their high school diploma on their resume, because you have advanced degrees, so you don't even need to put that on there. But even with your college degrees, people can really start to generalize you based on the year that you graduated college, even if you went back to school later on in life or anything like that. It just leaves too much opportunity to be judged. If you're still trying to make sense of all of this and you're tempted to go start Googling things and jump down that rabbit hole, just don't do it, because I've created a guide specifically for writing a nursing resume. And this is a totally free guide, step-by-step, no nonsense, straight to the point. It'll tell you how to create a nursing resume that will make it through ATSs and catch the eye of recruiters and hiring managers. So head over to nurse.org. I've included the link down below in the comments to that. We also have a really cool template on there that you can easily fill out to create your own resume that will then need to be targeted and altered for each role that you apply to. We're also working on some other great tools to help you simplify and streamline your job search. So make sure to visit nurse.org and also subscribe to my videos, but also turn on my notifications, because if you don't turn on notifications, you're actually not notified when I post a new video. So you could be missing out on some really good information. So to all of the nurses out there who are watching and who follow me on Instagram and here on YouTube, thank you so much for everything that you do. Thank you so much for being you.